One of the topics discussed today was disease transfer between humans and great apes. And joining me to carry on that debate are two panellists, Dr. Gladys Kalema-Sikusoma and Dr. Dominic Travis. Gladys, what is the biggest concern, do you think, that great apes face?
The biggest concern that great apes face is that they're surrounded by people who have very little health care, who are very poor, and who have very large families that they can't manage. And so as long as they have this poverty cycle, it's going to spill over to the great apes. We've had scabies skin disease in gorillas, which resulted in the death of a baby gorilla, and it came from people living around the park who have very little access to social services. So as long as people around the great ape protected areas are not being catered for, it's going to be very difficult to protect the gorillas and the great apes and to conserve biodiversity.
Dominic, we know disease transfer is not one way. We are genetically similar to our nearest cousins. What implications are there for health?
Yeah. So I think we need to start looking at health more as a big picture ecosystem level issue. So we have disease transfer back and forth between humans and apes in different directions depending on the issue, but we need to look at the ecosystem health issue. This includes the air, the water, the entire picture. Everything is interconnected, and we can't just talk about one disease or just little microbes moving back and forth between these two species.
Gladys, we know that the population numbers are falling dramatically, and it is alarming. So what can we do to safeguard the populations?
One thing that we can do is to provide better welfare for the people living around the protected areas, so they have less incentive to go into the great ape habitat. One, to cut down trees. Two, to go in and end up having a bigger interface and picking up diseases from each other. So I think we need to think about the humans if we're going to protect the great ape habitats.
The great apes don't have a long time. Time is running out. What can be done to ensure their future? And should government take a stance in this? Dominic first and then Gladys, please.
No, I think we need all hands on deck. This has been a history of different people from different perspectives working on their own angle, and we need to learn how to play together. This is a much bigger issue than just the smaller scientific or conservation issues. And so government at many levels has an obligation almost, or an opportunity to interact on that level, and especially in the sense of multicultural as well. We've got a lot of different cultures all claiming kind of global ownership of these endangered species, and there's a lot of different value systems that have to be reconciled.
Dominic has mentioned obligation by governments, but how willing are they to participate?
I think government is willing to participate, but we have to get governments to own the problem, and then they'll own the solution. They have to feel that it's their responsibility to do this. They have so many competing priorities. As I said, they have people who are very poor, they have people who are sick, so many competing priorities. So conservation always goes very far down the line. But then sometimes you have to put the case for conservation. For example, with great apes, tourism. Tourism is helping with economic development. And if great apes are conserved well, that money can help to lift people out of poverty. So governments we have to convince them to look at it holistically. And then they'll be able to own it and scale up all these interventions.